Hey guys, I wanted to do a quick update video on my stem cell progress. It's been 5 months since I had the injections done at Region X Cayman Islands with the cultured stem cells. They did the intradiscal into 4 of my discs as well as the surrounding ligaments, joints, and multifidi. So I was hoping to do updates before this more consistently. Um, but I was just kind of hoping for more progress and more results to post about. So it has been 5 months, and I just want to kind of let you know what I've been doing, how I'm doing, um, kind of what I'm looking forward to doing moving forward. So at this point, I'm still struggling a lot. So I'm in a lot of pain, and I'm still very limited in terms of all the things that I can do compared to what I would like to do. I've been doing a lot of the core work um, for probably the last, I don't know, 3 months maybe. And it's not like real intense stuff, but I'm doing it consistently, along with some multifidi work and some elliptical work, and then just walks. Um, Otherwise, I've been really busy with work, so a lot of sitting and driving. Um, which that doesn't help. And then I've had some flare ups here and there. So right now it's the end of January. About a month ago, just before Christmas, I had a flare up, and that kind of just before that, for a couple weeks, I was actually starting to feel like I was getting a little bit of progress, and then I had a flare up doing some physical activity, and then just kind of getting back on track since then has been tough. I've been working through it, and then about a week ago now, I had another flare up, kind of trying to add on a few more things um, as far as workout type stuff. The last one, it was like, yeah, I think it was about a week ago. I was just had the Bosu ball upside down in the gym and doing single leg balance stuff just to try to work on that, along with a couple new multifidi exercises. Those didn't go over too well. So um, anyway, at this point, I don't feel a lot of progress. I don't feel much progress at all, to be honest with you, but there's still plenty of time for it to work and for it to kick in. So I'm just holding out hope, trying to stay positive, and try to keep doing the right things, progressing, but staying patient at the same time. So, over the next couple weeks here is when I want to start swimming, and my plan is we're going on a trip, and maybe start swimming a little bit there, and then when we get back, I'm going to join the YMCA and start hitting the pool there. I follow another channel who who had stem cells. He went to Spain and had them. His name's David Spooner Tuner is his channel. I'll link it below. So if anyone else is looking at getting stem cells done, they can see his progress as well. Um, but essentially, his results kicked in at about between the 8 and 9 month mark, and I'm at 5 months now. And I went on the website that he went, the website of the clinic he went to, which is in Spain, and there was a testimonial of a guy who also had intradiscal injections there, and he said it on this testimonial. The guy's results really kicked in at 8 months. So for me, I'm hoping, in the next 3 to 4 months here, I can start feeling better, and I'm going to keep doing swimming. Once I start it, keep doing swimming, then I'm going to keep doing the core work and all that stuff, and then try to progress and advance from there. At this point, I've had some tough times, and it's just been hard to kind of think that it's gonna just all of a sudden kick in. But I'm really hoping that if I keep trying to do the right stuff and keep doing my walks here and there, that it'll get to the point where I'll have a miracle like those two did. The difference is, so I had a follow-up appointment with my doctor, and I asked him a few questions, one of which was how many stem cells were injected into my spine, and he said overall it was 5 million. So there was 1 million that went into each of my 4 discs, and then there was 1 million combined into the epidural space behind those discs, or I'm sorry, it was actually a 500,000 combined into the epidural space, and then a 500,000 combined into my joints, ligaments, and multifidi in those surrounding areas there. I did hear from the other channel, in the Spain clinic, they did 20 million in the bottom two discs, L4, L5, and L5S1, and that was for David from his channel as well as from the guy on their website. So it is a little bit different, but I know RegionX thinks that you don't need a very high dosage of stem cells to get the results from the intradiscal back pain relief in that regard. So I'm kind of holding out hope for that. I also asked how many stem cells I had banked there, because they gave, they cultured my remaining cells and then they store them at my, at the age that I was, so that if I ever needed to re-inject, they would bank them for me. And they have 30 million right now, 30 million of my cells banked at the Cayman Islands. And that's something where the good thing is, if I ever did want to go try again, I would not have to have such a long trip, because the culturing's already done. I wouldn't have to do the bone marrow aspiration where they take it out of the back of your iliac crest. And it would also reduce the cost, since that portion of the procedure is like $10,000. So you would, have a much more affordable process if it was just that one treatment appointment, as well as you could save on trip costs as well. But that would be a potential. If in the next 6 months, if I didn't get relief, I may go back. I guess another option would be to try that Spain clinic, but they usually culture for about 3 weeks. So it would be a long trip, and it would be the full cost as far as having to do the bone marrow aspiration as well as the re-injections. And then I did find online there's, hopefully it doesn't have to get to this, but just as far as, doing research on YouTube and online like I usually do, I found a clinic in California that does, they do like a minimally invasive surgery. It's called endoscopic washout, and it's for people that have disc pain and annular tear pain. A lot of annular tears are not painful, but the toxic annular tears are. His name's Dr. Tony Mork, M-O-R-K, and it sounds like a lot of patients have had a lot of success with him when they're patients that have disc pain, which is typically sitting pain, or if you did a CT discogram and felt, and they noticed that you did have an annular tear, and when they do inject into the disc, if you felt that similar pain that you're used to having, you could kind of go through the process of diagnosis if the disc is causing your pain versus other types of back pain. So that would be kind of like a last resort, because what they do is they flush out, they suction out and wash out the disc fragments that are causing a lot of pain, and they leave the annular tear open so that inflammatory chemicals can leak out into your epidural space and contact your nerves and cause a lot of pain and problems that way. So their whole thing is, if they get those fragments out of there which are causing pain, it'll also allow the tear to seal. But anyway, that's something that I have not even done a consultation, and I'm to the point right now where I've still got plenty of time for this initial stem cell treatment to take full effect and give me the results that I need. And if not, I probably would consider doing another stem cell treatment to see if I could avoid any type of surgery whatsoever, especially hearing the great results that I've heard from some unbiased people that have similar back pain and problems that I have. So yeah, at this point, I'm looking forward to starting to swim. I'm looking forward to our busy season with work getting over, so I don't have to sit in the car as much, and I can put a lot more time and effort into, just trying to get better. And there's, with these flare-ups that I've had, everyone talks about how the pain is not linear and how there's going to be ups and downs. And especially as I start trying to do things that I haven't done for a long time, it'll be challenging, but it's something that I know I can get through, and I know I will get through. And it's right now, it's just a matter of not going too fast, being patient, even if it feels like it's something that shouldn't be hard or difficult. I'm not physically the way I used to be, so it's just something that I gotta kind of slow roll and kind of just play it by ear and, you know, feel it out, feel my body, and you know, yeah, I guess I don't need to explain that anymore, but what I'll do is I'll show now a couple of YouTube videos of just some of the, I know I had a commenter that was asking for like what kind of exercises I was doing, and it's really just basic. If you've ever done like standard physical therapy, really basic stuff like the dead bug, just to engage the transverse abdominis, the deep core muscles, and hip disassociation to kind of get your hip mobility without having your spine take the brunt of that, while engaging your core, and then just the multifidi kind of on your hands and knees. But I'll show those as well, and if I can't show them, I'll link them below in the description. If you guys have any questions or anything, feel free to leave that in the comments, and I'll try to get back to those as soon as I can. And hoping I can do, you know, stay on these videos even if I don't have the pain relief progress that I want to. I just want to make sure that I'm updating everybody, and I appreciate your guys' well wishes. And yeah, I'm looking forward to results at this point. You know, I'm not in much of a better spot, but I think, you know, I do think the cells are doing something. A lot of my pain is right at the, you know, axial pain, kind of right at the L5S1 and then my mid back, but kind of that junction T12L1 area. But I've always felt kind of like a throbbing back there, and you know, I know that's like a sign of inflammation or like a warmth burning. So it could be that there are things taking place with the cells in there. Still been taking the same supplements, the turmeric, glucosamine, chondroitin, vitamin D3, magnesium. I did add in the serapeptase. It's a supplement that's was recommended from the channel of Spooner Tuner, which I'll put below. He's the one who had the stem cells from Spain, and he recommended that. He started doing that at about 5 months, which is when he started going to the chiropractor. For about a month, and it's supposed to break down like scar tissue, reduce inflammation and pain, and you know, it's all natural. So I've been taking that for about 4 days now, and you know, I'm trying to follow his blueprint. So on this coming week, I'm gonna go to the chiropractor for the first time since I've had the procedure, which is what he did at 5 months for about a month. And then at about 6 months is when he started swimming every day. So I'm gonna follow those steps and see if you know, if somebody has a blueprint for what works. I want to try to follow it and try to get those results. So yeah, I'm gonna keep taking the serapeptase, and I'm gonna start swimming, start going to chiropractor a little bit and see how that goes. As far as other treatments I've done, I've still been doing the physical therapy with you know, some fascial work. I've been doing core work. I've done a few times I've gone into the decompression, the DRX 9000, and I've ever since I had the stem cells, I've only done that first time I did 20 pounds. Since then I've reduced down. I did 15 pounds, and then every time since then I've done 12 pounds of pull, which has been for like the last 3 or 4 times. So I think I've done it about maybe 6 times since I've been back. I try not to do it because I do still, even at a lightweight, I still feel, you know, some of the negative repercussions or feelings of it. So, which is like a burning feeling, you know, and it just to me, I think, I just try to stay away from that in case it's, you know, not benefiting things. So I'm going to keep trying to, especially without having to do a bunch of sitting, I'm going to keep trying to stay away from that. When we fly back home, I might have to after long flights, but otherwise I'm going to kind of stick to the chiropractor if that goes well this week. But I'll kind of play that by ear and see how my body responds to that. Anyway, I'll show some of the some of the core exercises that you guys wanted to see, and otherwise I'll try to stay in touch and post more updates for you guys. Thank you. Take care.